Hi, I'm Dr. Don Steensma. I'm a practicing optometrist. I hope you enjoy this brief presentation on diabetic retinopathy.
Diabetic retinopathy is a serious complication of diabetes. It is a leading cause of blindness in this country. It occurs when the diabetes damages the tiny blood vessels inside the retina. One of the biggest problems with diabetic retinopathy is there are no obvious signs in the early stages. By the time vision is being affected, there usually is significant damage to the retina. There are 5 stages of diabetic retinopathy: mild non-proliferative retinopathy, moderate non-proliferative retinopathy, severe non-proliferative retinopathy, and proliferative retinopathy. Macular edema can happen in any of the other 4 stages. Mild non-proliferative retinopathy. At this earliest stage, the only thing you note are microaneurysms. Microaneurysms are little balloon-like swellings in the blood vessel. When you look at the retina, all you see is a little red dot. Note the solitary microaneurysm. As the retinopathy worsens to a moderate level, more and more blood vessels are breaking down, releasing blood. What you would note would be small little hemorrhages throughout the retina. Note the multiple small hemorrhages throughout the retina. As the retinopathy worsens even more and more hemorrhages are noted, and more severe hypoxia or lack of oxygen to the tissues. Eventually, those tissues secrete chemicals which encourage new blood vessel growth. With the growth of new blood vessels, this becomes proliferative retinopathy. Note the extensive hemorrhaging throughout the retina. The red areas are blood, the white areas are exudates or fluid. In proliferative retinopathy, new blood vessels grow on the surface of the retina. These new blood vessels are not like normal blood vessels and become very fragile and oftentimes leak. After a period of time, they can become fibrotic, and as they shrink, they can cause a retinal detachment and possible blindness. Note the unusual-looking blood vessels within the circle. If the blood vessels leak near the macula, fluid can accumulate within the macula. This produces edema and swelling and loss of vision. This can happen at any stage of diabetic retinopathy. About half the people with proliferative diabetic retinopathy have macular edema. Note the central hemorrhages with the surround of macular edema. The edema is manifested as white spots. This is sometimes referred to as circling of the wagons. Everyone with diabetes, both type 1 and type 2, are at risk for developing diabetic retinopathy. Obviously, the better control of the diabetes, the less the risk of developing diabetic retinopathy. Approximately 45% of Americans diagnosed with diabetes have some stage of diabetic retinopathy at that point. Pregnancy is a special concern for women. All pregnant women should have their eyes examined. In most cases, there are no symptoms of diabetic retinopathy. By the time your vision is affected, usually there's significant damage to the retina. If the bleeding is in the macular area, vision will decrease, and proliferative diabetic retinopathy can lead to blindness. The only way to detect diabetic retinopathy is to look in the eye. I will take retinal photographs, and if any retinopathy develops, it will be very apparent. During the first 3 stages of diabetic retinopathy, no retinal treatment is required unless you have macular edema. To prevent progression of diabetic retinopathy, people with diabetes should control their level of blood sugar, blood pressure, and blood cholesterol. The microaneurysms of mild retinopathy will not affect vision, and the hemorrhages of moderate retinopathy will resolve if the person can manage to get their sugar under better control. There are 3 ways to treat proliferative retinopathy: scatter laser treatments, VEGF therapy, and vitrectomy surgery. In scatter laser treatments, multiple laser burns are produced in the peripheral retina. This damages the peripheral tissues, which decreases their need for oxygen. Therefore, there's more oxygen for the central macular area. Note the thousands of peripheral laser scars, and also note some central hemorrhaging. Vascular endothelial growth factors inhibit new blood vessel growth, therefore slowing down the proliferation of neovascularization. Vascular endothelial growth factors are very exciting. Recent studies show significant reduction in new blood vessel growth with VEGF. Vitrectomy is a surgical procedure in which they remove the blood-stained vitreous tissues. It does not stop the progress of the disease. It only removes the cloudy vitreous, allowing better vision. When the leaky blood vessels leak fluid and blood into the macular area, causing macular edema, laser burns conceal the retinal leakage. Note the macular edema, which is seen as little white spots. Note the dark laser scars. Both scatter and focal laser treatments are very effective in reducing vision loss. However, they do not cure the condition. Many diabetics with retinopathy seem to feel once they have a laser treatment, their eye disease is cured. It's not. They have to take control of the diabetes to stop progression of the disease process. If you're diabetic, try and take charge of your disease. Have a complete examination with diabetic pupils every year. We can watch for changes in your retinal photographs from year to year if retinopathy does develop. Try to maintain good glucose control through exercise, diet, and weight control. Educate yourself. Go online. American Diabetic Association. There's tons of research out there. Consult with a dietitian. See your physician as instructed. I hope this presentation was helpful.